Bloomberg Audio Studios. Podcasts, radio, news.
Welcome to Bloomberg UK Politics, your bite-sized guide to the corridors of power. I'm Yuan.
And I'm Lizzy Burden. Welcome to the programme. If you're squeamish, a bit of a trigger warning. We're going to talk about blood today. We're going to talk about contaminated blood because yesterday a 7-year inquiry into the biggest treatment failure in NHS history culminated in the publication of the Infected Blood Inquiry report. Now, it was a scandal that saw more than 30,000 people infected with deadly viruses while they were receiving NHS care, and it happened between the 1970s and the 1990s. Since then, 3,000 people have died as a result, but crucially, the report concludes that those deaths were preventable. Now, the chair of the inquiry, Sir Brian Langstaff, said that the disaster was not an accident, but in fact, it was the result of repeated failures from the NHS and the government.
The NHS and successive governments compounded the agony by refusing to accept that wrong had been done. More than that, the government repeatedly maintained that people received the best available treatment, and both claims were untrue.
Well, Langstaff has called for compensation and public recognition for the victims. Both the Prime Minister and the CEO of NHS England have already apologised. We're expecting a statement on the exact compensation package in the Commons later today. But Lizzy, as with all inquiries, perhaps the most crucial part is the learnings to stop something similar ever happening again. So today we're going to examine what those learnings are. The report refers to the defensive culture within the NHS, which was partly responsible for this scandal. The question is, does that culture still exist? And what role did other public servants have to play? Langstaff says that they, quote, sought to mislead several ministers about the extent of the problem. So do those underlying issues which allowed a tragedy to take place on such a large scale still exist today? What needs to be done to fix them? Yeah,
really important questions. We're going to dig into them later in the programme. But first, we're joined by Bloomberg UK politics reporter James Woolcock. And James, let's start by setting out what the report said about the causes of the scandal.
I think, Lizzy, just going into this, I need to say that as someone who's read the report this morning overnight, I've read a few sort of public inquiries in my time, Grenfell, Leveson, Chilcot, even sort of non-official public ones like Partygate, and this really is off the scale on the amount of failings, the scale of condemnation of the civil servants and government and NHS involved. I can't recall a time I've read anything like it. And to those causes questions, the reason why I say that is it really is everywhere. You go into licensing failures around the blood, the sort of issues of supply chain, issues with researching how this could have been done better. That's sort of the pre-infection stage. Then you have an attitude of denial, this idea of false reasoning and reassurance of the public as it was happening, using teenagers as research subjects without their consent and without asking them. And this is all sort of during the period. And then afterwards, the report found evidence of destruction of documents, sort of active hiding information from ministers, and then NHS clinicians and government spokespeople going out and telling that people got the best treatment possible when that was simply not true. And the report goes into so many different things, it is hard to sum them up into one sort of set of areas. But broadly, it says there was no regard for patient safety. The government and civil servants were slow to deal with these sort of issues as they came up. It took decades. It was unethical in the medical practice being used. It was then defensive in how it tried to hide and shy away from this area. Langstaff says, cover up is appropriate, but the words he prefers is hiding of truth. There was no conspiracy, he says. Just a set of actors who never wanted to face up to the fact that this was happening, and successive governments who would rather have not paid out to the victims, who would rather have not had difficult questions to answer about the NHS, and would rather have not had to take on the political responsibility for that moment, which put this back decades. And he found then another harm, which when you took in that lack of ethics and that lack of willingness to take responsibility, the people who were suffering with HIV and hepatitis C, diagnoses that were not their fault, then also had to live with the shame and alienation of being told that it was nothing to do with the state. And the state had no responsibility for it and bears no liability for it and wasn't going to pay out anything and didn't acknowledge any fault. And that, Langstaff argues, caused further psychological harm. And this report, going back decades of injustice, is so broad in its scope and so damning, you start to understand the political implications of why the Prime Minister yesterday was so clear and hard-lined about his apology.
James, paying out compensation to these thousands of people is clearly one of the reasons why this has all been delayed for so long. What are we expecting? We're going to find out in the Commons, aren't we, later on today about this?
Yes, John Glenn, the Playmaster Channel, is speaking later today in Parliament. Bloomberg has learned this compensation could tot up into the tens of billions, potentially more. And that speaks to sort of the damages I've just outlined. The way the report advises the government to deal with it is to sort of split it into looking at each individual case and the kind of harms, social, health, mental, reputational, and then to compensate accordingly and to compensate the families for the care that's needed and the reputational damage to those who've already lost them. And that is why the costs are so high. It is also why, at the point when the UK is at a very fiscally awkward and difficult position where you can't find 10 billion plus down the back of the sofa, that despite all of that, the Conservative government feel they really have no choice to do that.
James, thanks so much for giving us those details. Bloomberg's James Woolcock.
The compensation's due, the apologies have been issued, but how can those in leadership positions prevent something so awful from happening again? Joining us now is Cara McGoogan, who's author of a book about the scandal called The Poison Line: Life and Death in the Infected Blood Scandal. Cara, you followed this story in depth. What, in your mind, were the biggest failures that led to this disaster?
So it starts right back at the beginning when this product, Factor 8 for haemophilia, is licensed in 1983 to be imported from America. And what we've heard is it should never have been given that go-ahead to be bought by the UK. In America, it was known that pharmaceutical companies were collecting high-risk plasmas from donors, including prisoners, intravenous drug users, sex workers, and from sexually transmitted disease clinics. They were then pooling thousands of donations together, and only one person needed a bloodborne virus to contaminate the whole batch. So right at the beginning, from the start of Factor 8, it was known that it could transmit hepatitis and that the American version was more likely to contain it. And so that really is the beginning. We should never have imported this product. Then you've got the slow reaction to hepatitis and AIDS. For me, a powerful thing was Brian Langstaff, the chair, saying that from 1982, 1983, we should have known that AIDS was transmitted through a bloodborne agent and we should have taken precautionary measures. But we didn't do that. In the UK, we were still injecting patients with this treatment into 1985. Patients weren't given warnings and they weren't given the choice about what to do with their treatment, if they wanted to have this treatment knowing the risks or if they wanted to go back to an earlier safer treatment. And so that lack of knowledge that was given to patients really compounded the damage because, a lot of people would have probably chosen not to have that treatment. So that patient choice is a big issue in this. And then we've got the cover-up, what came after the fact. And so Brian described a culture of defensiveness in both the civil service and the NHS. So that really spans the kind of 50-year period from the start of Factor 8 through to the cover-up that has led us to today.
Yeah, I want to ask you about that defensive culture. We've heard about this before within the NHS. How much of a factor was that in this terrible scandal?
It's a big issue in this scandal. I mean, we have two issues here. The first is the idea of not giving patients the knowledge. In this scandal, this was back in the 70s and 80s, so it's not necessarily the same now. But the idea that doctor was God, the patrician medical culture that meant that patients weren't armed with knowledge of their treatment and they were just given what the doctors recommended. That is a big issue. And as part of that, patients were enrolled in medical trials without their knowledge, which is a huge breach of trust. And there has been talk of it breaching the Nuremberg Code, which is that patients have to be given informed consent to take part in medical trials. But then what we see, yes, this culture of defensiveness after the fact, not being open and honest with patients. We've heard stories of people not being given HIV diagnoses for years, and that's part of not wanting to reveal what had happened. Being told that they had the best treatment available, that this was an unforeseen crisis, that doctors couldn't have known it was coming, when we know that they now could have done. And, medical notes have gone missing. People haven't been told the truth.
Cara, this defensive culture in the NHS, I wonder how much of it comes down to NHS funding, and then how much of the overall scandal lies at the door of the civil service, and if those problems are still present today, how the government can prevent something like this from happening again.
So funding is definitely a question. The civil service, the Department of Health, didn't put enough funding into making Britain self-sufficient in Factor VIII. So we didn't build up our own transfusion and plasma collection services enough to be able to fulfill our needs. And so that is why we were kind of plugging the gap by importing. So that really is an issue. And doctors were worried as they're treating patients, will I have enough of the NHS version, the safer version? No, I'll have to kind of plug the gap. So there was definitely a question of that. Also, there was a sort of cosy relationship between doctors and pharma companies. And pharma companies were able to provide some funding for doctors and their staff to go to medical conferences to help give them a bit of a revamp of their centre. And so that sort of funding question where you've got pharmaceutical companies filling the gap and that may be leading to more of their Factor VIII being used is a big question. I think there are worrying parallels with today when you've heard the maternity health crisis that we've been talking about the last few weeks, hospitals and special measures. There does seem to be this culture of kind of locking down when something goes wrong, not being transparent initially and wanting to kind of protect. You can understand that, want to kind of have your own back, but I think what we should prioritise is addressing to patients when something goes wrong, because it adds to the trauma that they've experienced.
Really shocking that something like this could happen really not that long ago. Do you think that something like this could happen again or something similar to this?
When it comes to the plasma trade, it still is flourishing in America and we are still importing plasma products. Technology is a lot better now to kill off viruses, but there's still an element of exploitation in paying American plasma donors for their plasma. And so there is still a question of vigilance. We need to keep an eye on that, and we need to kind of, if there was ever a sign of a new bloodborne pathogen, we need to react immediately and not play this waiting game that we did before. When it comes to medical scandals, there will always be issues. Hopefully we are better equipped to react to them. But I think a lot of people have talked about this duty of candour and also this ending the defensiveness culture, both for the civil service and the NHS. And I think we really need to address that. It's not a bad thing to own up when something goes wrong. It can lead to preventing mistakes in the future and saving lives, potentially. When we look at the airline industry, they're very good at holding inquiries, looking at the black box and preventing future crashes. That is what we should be doing.
Cara McGoogan, author of The Poison Life and Death in the Infected Blood Scandal. Thanks for joining us on Bloomberg UK Politics.
Well, that's it for us from today. If you like the programme, don't forget to subscribe and give it 5 stars so other people can find it on Apple Podcasts, Spotify or wherever you listen.
This episode was produced by Tiwa Adebayo and our audio engineer was Sean Grostamakia. I'm Yuan Potts.
And I'm Lizzy Burden. We'll be back with more tomorrow. This is Bloomberg.
Bloomberg UK Politics. Listen weekdays at noon on DAB Digital Radio in London.